Everyone is entitled to equal access care. But for a large portion of our population, a visit to a doctor's office is both stressful and ineffective because of the barriers created by equipment that does not address the physical limitations of all patients, including the elderly and disabled population.
I think for any of us, when we see someone coming in the office who's disabled, it's a bit of a challenge to decide, do we have enough time? Have we allowed for enough people to give us a hand getting someone on the table? So anything we can do to decrease the barrier really is helpful, both time-wise and personnel-wise.
When you go to one of these healthcare facilities, and it's really good, they've got good accessible parking, a nice accessible path of travel, a lowered counter in the waiting area, nice wide aisles into a nice wide big exam room. But then you look in there and they got the old box inaccessible exam table. People just forget that that's just as important as every other element of access, and sometimes even more important, because that's where the most critical conversation goes on with your health provider when you're on that table.
When you look at an examination that's being performed by a physician, there are a lot of different parts that go along with that, and the physician needs to use all their senses. Their ability to see and listen are certainly important, but the whole idea of touching the patient, palpating particular areas, is an important part of the exam.
I have friends who have actually postponed going to a doctor because of the hassles they've experienced in getting care. And because of this, they've had delayed diagnosis, they've had worsening conditions, and actually I can think of 2 people that were good friends who actually died because they didn't get the care they needed, because they didn't feel it was worth the hassle they'd have to go through to get the care.
To address these important issues, Midmark Corporation has created a line of barrier-free tables that are more chair-like, allowing the patient's feet to rest comfortably on the floor while waiting for the physician. These tables offer an 18-inch height from the floor at the lowest position to a fully extended height of 37 inches. The minimum height is actually lower than a standard chair, making it possible for patients of all heights and sizes to sit with ease.
If the table is at the appropriate height, then I can get off the table easily and safely. Otherwise, I can lose my balance, I can fall to the floor. So having the table to adjust to the height that is appropriate for me, it makes it so much easier and safer. As you can see that the control curve in a little bit. So for someone who don't have a lot of balance, it gave us a little sense of safety that I'm being sort of cradled.
Midmark's barrier-free tables reduce the likelihood of distress and injury to patients who may have difficulty in accessing an industry-standard box-style exam table, and help maintain patient dignity and reduce anxiety. Designed with the support of physicians and advocacy groups, Midmark's barrier-free tables can help create an efficient and comfortable environment for patients, physicians, and staff, whether treating the elderly, obese, expectant mothers, or patients with disabilities. For the patient, the tables offer safe access and eliminate the discomfort that comes from sitting with their legs dangling without support for their back.
You know, one of the things that's really important as you're transferring is to provide a level surface so that you're not fighting against gravity in essence. And so a table that's at the height of the wheelchair, and wheelchairs do come in different heights. The table that's adjustable that meets the height of the wheelchair is the ideal situation for transfer. One of the important aspects of the table is that its ability to go flat, because when you're transferring from the wheelchair onto the table, you don't need to fight any additional angles that might be there and make it more difficult in your transfer.
I think the table is very nice because I think it's very inviting to the patient. When the patient walks into the room, it's at their level. They're not looking at a table that they have to crawl up onto, swivel around, sit down, and then they're sitting above everybody in the room. We're all at the same level when the patient walks in with this table, and it's no different than sitting in a chair for them.
Under the Americans with Disabilities Act, or ADA, All healthcare facilities must now be accessible for everyone and free from barriers that make it difficult or impossible to use the facility. Providing accessible exam tables is a requirement in order to comply with legal obligations under Titles II and III of the ADA. Physicians are legally obligated to always meet these requirements and can easily suffer the consequences if a patient feels those requirements are not being met. Patients are not the only ones suffering when the appropriate equipment isn't in place to help move and lift people. Healthcare workers have among the highest back and shoulder injury rates of any occupational group.
I've learned that one of the interesting things about the healthcare industry is that healthcare providers are trained to a great extent to make it work no matter what. No matter what the equipment, no matter what problems they're having, they have to provide the care. So that puts a great deal of burden on these folks, and I think we need to be better at encouraging them to speak up for themselves as well and say, with a better piece of equipment, I could provide better care, I could provide better access, I would be less injured, I would be able to stay in my job longer, even as I lose my abilities as I age.
Connecting the dots in healthcare basically means that if you want to protect your patients, you have to protect your healthcare workers. We know, for example, that the nursing shortage, less nursing hours at the bedside, and the physical demands of the job create negative patient outcomes. The last dot that needs to be connected in this industry is that nursing injury rates contribute to all three of the above.
Without being able to set yourself up appropriately, you're reaching really far forward. And I actually had a very serious back injury that hindered me for many years, and I'm not able to do some of the work that I used to do because of that. I've read also several statistics from nursing industry and others. We have plenty of nurses. They just don't happen to be working. Most of them, when surveyed, will tell us the reason they don't work is because of back injuries.
Prior to actually having this table, one of the issues for us is whenever we had anyone with any kind of physical disability or overly obese patient, we always tried to make sure that we had more than one staff person in the room to assist them with actually getting on the table. Our concerns were for safety, of course, for the patient, but also for staff. So this has been a great assistance for us, because staff were telling us basically that this individual was either physically incapacitated and or obese, to the extent that the staff were worried whether they were going to be able to adequately and properly get the person onto the table so that an exam could be completed.
I think the tables increase patient flow from a couple different ways. One, the time it takes to move patients back and forth on each end of their office visit is greatly decreased, but it also takes less office staff to do that. You know, we don't deadlift as many patients up and down. It takes normally one office person to help move a patient across. We don't stop the whole office and draw everybody in to help move a patient. It doesn't pull people away from other duties to do that. So I think that's another real advantage flow-wise through the office.
I think that the healthcare field doesn't realize how broad the population is that could actually benefit from accessible equipment. 1 in 5 people have some form of disability. People 65 and older, of that group, 50% of those people have some form of disability. Plus all of us baby boomers, we're all experiencing either increasing limitations or for the first time experiencing new issues with vision and hearing and mobility and just movement, ease of movement. So actually, when you think of the population that could benefit by increased access, it's not this small, insignificant group that many people think it is. It's actually huge.